Good evening and welcome to our nightly telecast of Just the News, where we bring you all of the important things that have happened in the country today without any of the drama. Let's get straight to it. The government has now announced that everyone above the age of 18 will be eligible for the COVID-19 vaccines in the third phase of the vaccination beginning the 1st of May this year. The decision was taken at a meeting chaired by the Prime Minister today. This is part of phase 3 of the vaccination drive. Including this announcement, the phase 3 will also allow vaccine manufacturers free to supply 50% of doses to state governments and also free to sell the doses in the open market at a pre-declared rate. Manufacturers would need to make an advance declaration of the price of the 50% of supply that they're making available to state governments and to the open market. States will also be empowered to procure additional vaccine doses directly from the manufacturers and open up the vaccines to anyone above the age of 18 as they see fit. The division of vaccine supply, which is 50% to the government of India and 50% to the states, will be applicable uniformly across all vaccines manufactured in the country. Remember, the first stage of the vaccination began on the 16th of January, where people above the age of 60 were vaccinated. After that, in the next phase, it was people above the age of 45, and now this is phase 3. Moving on now to the COVID numbers that India has announced. India has recorded 2,74,000 new COVID cases in the last 24 hours, 1,619 deaths on record. Again, this is the single highest day spike ever. Maharashtra remains the worst affected state with 68,631 cases. Now, in the middle of the second wave of COVID-19, the government has concluded the existing insurance scheme which allowed 50 lakh rupees cover to healthcare workers who were infected or who died in the line of COVID duty. The Ministry of Health tweeted today saying, and I quote, "A new dispensation will be provided to cover corona warriors, for which the ministry is in talks with insurance companies." The insurance company is the New India Assurance Company. This was known as the Pradhan Mantri Garib Kalyan package, the insurance scheme which provided a safety net to healthcare workers who were infected with the virus while in the line of duty. A letter by the Union Health Secretary states that the Yojana, or the insurance scheme for healthcare workers fighting COVID-19, was implemented with effect of the 30th of March last year. Initially, a period of 90 days to provide insurance cover of 50 lakh rupees to healthcare workers fighting the pandemic, but the duration of that scheme was extended until the 24th of March this year. Delhi has announced a 6-day lockdown starting 10 p.m. tonight until 5 a.m. next Monday, that's the 26th of April. This comes after the national capital registered over 25,000 cases yesterday. The Chief Minister of Delhi, Arvind, Kejriwal, has said, and I quote, "Delhi's health system is at a breaking point. I will not say it has collapsed, but the COVID situation is pretty critical," end quote. As per the lockdown, the following categories of people are allowed to move around the city with their IDs. Government officials of both Government of India and Delhi government, judicial officers and court staff, medical personnel, pregnant women, patients along with attendants and doctor certificates, COVID-19 testing and vaccination movement, diplomatic staff, print and electronic media, and students appearing for their examinations. There's no restriction at all on interstate travel and transport of essential goods. No e-pass is necessary. Public transport is allowed. Metro buses, autos, taxis will continue with limited seating. Movement of people in essential services will be allowed with a pass. That includes shops with all kinds of food, pharma, newspaper distribution, banks and insurance, telecom, internet, delivery of essential goods, petrol pumps, food delivery and takeaway. Religious places will stay open, but no visitors will be allowed. A maximum of 50 people at weddings and 20 people at funerals. Private offices, educational institutions, malls, gyms, parks, spas, salons, pools will be closed. Social gatherings are prohibited. Chief Minister Arvind Kejriwal has said that Delhi is also facing an acute shortage of medical oxygen supply. He has alleged that the centre is diverting Delhi's quota of oxygen to other states. He has tweeted, and I quote, "Delhi is facing an acute shortage of oxygen. In view of sharply increasing cases, Delhi needs much more than normal supply rather than increasing our normal supply, has been sharply reduced and Delhi's quota has been diverted, to other states. Oxygen has become an emergency in Delhi, end quote. The Health Minister, Dr. Harshvardhan, has responded to former Prime Minister Dr. Manmohan Singh's suggestions to the government, asking the former Prime Minister to urge Congress party members of his own party to follow his advice and show gratitude for the work that was done in fighting the virus. This comes a day after Dr. Manmohan Singh wrote to the Prime Minister saying that the country is facing an unprecedented emergency. He offered 5 suggestions to the government to boost vaccinations in the country, including asking the centre to make public the details of orders placed by the government for COVID vaccine doses, to indicate the strategy to be distributed by them in a transparent manner. In reply, Dr. Harshvardhan, the Union Minister of Health, has said it is saddening, Dr. Singh, that while you well understand the importance of the vaccination, people in responsible positions in your own party as well as state governments formed by your party don't seem to share your view. It is shocking that senior members of the Congress party are yet to utter a single word of gratitude to our scientist community and vaccine manufacturers for innovating under trying circumstances. He also said that Congress-ruled states have become big contributors to the second wave. In the meantime, the former Prime Minister Dr. Manmohan Singh has been admitted to the AIIMS in Delhi after testing positive for COVID today. In Maharashtra, the Mumbai police on Saturday night called in for questioning Rajesh Dukhania, the director of Brook Pharma, a Daman-based pharmaceutical manufacturing company that manufactures Remdesivir, on suspicions that the company was hoarding a large number of Remdesivir doses because the police apparently received intelligence that the company had in its possession 6,000 vials valuing about 4.73 crore rupees. Soon after, he was called in for questioning. Former Maharashtra Chief Minister and BJP leader Devendra Fadnavis and leader of opposition in the Maharashtra Legislative Council, Darekar, also rushed to the police station. It turned out that the order for Remdesivir was placed by the BJP in the state. Devendra Fadnavis spoke to the press and said the Daman-based Brook Pharma Private Limited is one of the exporters of Remdesivir, whom we, BJP leaders, had contacted to supply stock to Maharashtra as the state is facing a shortage. We had informed the state FDA minister Rajendra Singh about it and approached the union government seeking necessary permissions. According to the Indian Express, Darekar said the BJP wanted to distribute the drug through the state government. As a noble gesture, we decided to foot the entire cost of the 4.75 crore rupees. Fadnavis was to hand over the stock to the Chief Minister, Uddhav Thackeray. In a detailed press statement, the police have now said that they had specific information about the stocking of a large quantity of Remdesivir medicine. Considering it a life-saving drug for COVID-19 patients and acting on that information, the director of the pharma company was called in for inquiry. The police statement goes on to say that at 11:15 p.m., former Chief Minister and senior politicians came to the police station in BKC. Mr. Fadnavis inquired as to why the director of the pharmaceutical company had been called to the police station. He said permission was taken from the FDA commissioner to donate the drug to the Maharashtra government. The police goes on to say the information was not shared with the BKC police and they had acted in good faith. Speaking to reporters in Nagpur on Sunday, Mr. Fadnavis said the BJP was not purchasing the drug, they were procuring it for Maharashtra and the Food and Drug Administration had given approval for it. Doing politics over the issue is wrong. False news is being spread that we had possessed the stock of Remdesivir, end quote. Maharashtra Home Minister Dilip Valse Patil has ordered an inquiry into the matter and Mr. Fadnavis has said he is ready for any such inquiry. The Shiv Sena editorial Samna criticized Devendra Fadnavis and Darekar, saying that the BJP has a clear agenda that the Maharashtra government should fail in the handling of the COVID situation. Moving on now to all of the new restrictions and lockdowns that have been announced by various state governments. Let's start with Rajasthan. Rajasthan has announced a 15-day curfew starting Monday until the 3rd of May. Only essential services, state and central government offices, health services, mandis, groceries, dairies and ration shops will be allowed. Malls, shopping complexes, cinema halls and all religious places will be closed. All education institutions and political programs have been suspended. Travellers visiting Rajasthan will have to show a negative RT-PCR test collected within 72 hours of travel. In Maharashtra, train passengers from Kerala, Goa, Rajasthan, Delhi, Gujarat and Uttarakhand will now need a negative RT-PCR test to enter the state. The test needs to be taken 48 hours before travel. As per the order, no unreserved tickets for Maharashtra should be issued on trains coming in from these 6 states. In West Bengal, where elections continue, the state government has announced that all government schools in West Bengal will be shut from tomorrow. That's the 20th of April. The state government has announced that summer vacations for all schools will begin on the 7th of May. State Education Minister Partha Chatterjee has said that the government will certainly take a decision in interest of the students at an appropriate time considering the COVID-19 situation. In view of the restrictions that have been announced in the state of Maharashtra, the state government has announced a 5,476 crore rupee relief package that aims to benefit several people who will be unable to work right now. Underneath that package, under the National Food Security Act, 7 crore beneficiaries will get 3 kgs of wheat and 2 kgs of rice free for 1 month. 12 lakh construction workers will get grants of 1,500 rupees each. 5 lakh hawkers or street vendors and 12 lakh auto rickshaw drivers will get a direct benefit transfer of 1,500 rupees each. The Shiv Bhojan, which is a free meal which originally used to cost 10 rupees, will now be available free for the next 1 month. Tribal households will get 2,000 rupees per family. The plan also talks about aid to 25 lakh domestic workers but doesn't specify the quantum of that aid. A veteran journalist from Uttar Pradesh, Vinay Srivastava, passed away after his oxygen level dropped to 31 compared to the normal mark, which should be about 95. He had complained of uneasiness a day before, and by night his oxygen level had started to drop. The 65-year-old journalist had said that no hospital labs or doctors were answering his calls. His son, Harshit Srivastava, tried to get medical help, but was turned away because they didn't have the COVID test result that they needed. According to the print, Harshit Srivastava has been quoted saying, "We ran pillar to post but could not get an oxygen cylinder for him. There was quite a long queue for that and I had to fight with others to save my father. His sample was collected on Saturday morning, but we could only get the results after 3 days. No hospital was willing to admit him without the COVID positive report, even though he had all the symptoms of the disease." In his last tweet, the journalist Vinay Srivastava said, "I am 65 years old, my oxygen level has hit 52, no hospital lab or doctor is picking up my call," and he asked for help. Moving on now to news coming in from the world of business. The Indian rupee has slumped 52 paise and is now trading at 74 rupees and 87 paise against the US dollar in opening trade on Monday. This comes after fears of a rapid resurgence of COVID-19 cases in the country that could disrupt economic recovery. Apart from this, there was a heavy sell-off in the domestic stock market as well. The Sensex opened over 1,000 points lower this morning and closed the day 883 points lower as investors sold stock in anticipation of further lockdowns because of rising COVID cases. News coming in from across the world right now. Hong Kong has decided to suspend all flights from India from the 20th of April, that's tomorrow, for the next 14 days. This comes after dozens of passengers tested positive on a Vistara flight from New Delhi. A similar suspension has been placed on flights coming in from Pakistan and the Philippines. Israel has decided to lift its outdoor mask mandate and reopen its education systems. This comes after Israel's mass vaccination drive, which has been declared a success. Following the drop in infection rates, Israel's health ministry has advised public to wear face coverings at large outdoor gatherings and stressed that mask wearing is still obligatory indoors. British Prime Minister Boris Johnson's visit to India has been put off. He was scheduled to visit India on the 25th and the 26th of April. Announcing this, the Ministry of External Affairs of India has said in view of the prevailing COVID situation, it has been decided by mutual agreement that the President of the United Kingdom will not visit India next week. He also said that both sides, however, are still meeting virtually in the coming days to launch plans for a transformed India-UK relationship. End quote. News from science and technology at this point. According to Bloomberg, Oxford has begun a trial which involves deliberately reinfecting people who have fought COVID-19 once already. This includes 64 healthy but previously COVID-infected volunteers from the age groups of 18 to 30 who will be studied under controlled quarantine conditions for the next 17 days. The data to be made available after several months will help vaccine developers look at levels and types of immunity needed to prevent reinfection and also decide how long the protection persists. News from the world of sports at this point. Roger Federer has announced that he will kickstart his clay court campaign at next month's Geneva Open as he steps up his preparations for the French Open. Federer has missed more than a year of games due to a knee injury, and he has returned to tour last month for the Qatar Open. He's tweeted saying, "Happy to let you know that I will play Geneva and Paris. Until then, I will use the time to train. Can't wait to play in Switzerland again." End quote. For cricket, Muttiah Muralitharan, Sri Lanka's cricket legend, has undergone an angioplasty at a Chennai city hospital. Muralitharan is in India for the IPL. He is part of the support staff for the Sunrisers Hyderabad. He has been their bowling coach and mentor since 2015. Sources say that this was a planned procedure and he's doing well now. Leaving you with one bit of positive news. Over 1.14 lakh employees of the Life Insurance Corporation, or LIC, will get a 25% hike in their salary. The hike includes loading of 15% given after 100% neutralization of the dearness allowance. Where the All India Insurance Employees Association had demanded a 40% wage hike after negotiations, it was settled at 25%. That brings us to the end of this bulletin. Thank you so much for watching. Remember, stay at home if you can. There are several helpline numbers that have also been posted on my Instagram page for various cities that you can get in touch with if you need hospitalization, a bed or oxygen. State governments and city governments are beginning to put out those numbers which you can access. But in the meantime, the best we can do is stay home, wear a mask and be really careful. Thank you for watching. Good night.